So today we're going to be talking about the UCLA schizophrenia study from the 1980s. This study specifically looked at schizophrenia patients and their withdrawal symptoms. The study started out by asking patients with diagnosed schizophrenia to come and try a new medication, and then patients were then at random selected to take a placebo, and their withdrawal effects were then studied. It raises a lot of ethical questions. Specifically, what kind of knowledge did we even learn from this?
The main aim of the study was to understand how people with schizophrenia responded when antipsychotic medication was reduced or stopped, more specifically, looking at relapse timing and symptom return.
Yeah, and what stood out to me was that it wasn't just about relapse. It was also questioning whether continuous medication was necessary for all the patients, which later became controversial once families started raising concern.
I agree, and I think that's where that ethical tension begins. The goals sound scientific, but it ignores how risky medication withdrawal is for this population.
And one major thing learned was how fragile stability is for people with schizophrenia. So even patients who appeared stable relapsed quickly when they were withdrawn from the medication.
And that lines up with the earlier research, too. Wyatt in 1991 showed that withdrawing antipsychotics induces relapse, or it increases the relapse risk. And that makes the study's design even more concerning.
And from a nursing perspective, that really reinforces how critical medication adherence is and why withdrawal should only happen with extreme caution.
Ethically, autonomy, beneficence, and non malfeasance and justice all were at risk in this study.
I agree. Autonomy was especially compromised because schizophrenia affects decision making. Fully informed consent was difficult. And according to a study from Roberts in 1994, he reported that families later felt risks weren't clearly explained to them.
And even if consent technically happened, beneficence and non-maleficence come into conflict when we already know medication withdrawal causes harm, like increased relapse rates that the studies already previously showed back in 1982.
And according to Provisions 3 of the ANA Code of Ethics, nurses are responsible for protecting patient safety, even in research settings.
So that's saying if a nurse observes early relapse or distress, ethically, they'd have to intervene, even if the protocol for the study said to continue.
In Provision 6, it also applies here because the nurses help to shape the ethical environments. Research settings don't exempt us from that responsibility.
One major change would have been avoiding complete medication withdrawal. Instead, researchers could have used gradual dose reduction with immediate reinstitution of medication at the first signs of relapse. And then, according to Applebaum in 1996, he specifically discusses this as a safer alternative when studying treatment effects.
Yeah, I agree, especially since we already know how destabilizing withdrawal can be. Gradually tapering would have reduced the severity of the relapse and still allowed for the researchers to observe the symptoms.
Another important change would have been a stronger assessment of decision-making capacity because schizophrenia can impair judgment. Enhanced capacity evaluations and the use of independent patient advocates could have really strengthened informed consent.
Yeah, and having an independent advocate there would have helped ensure the participants truly understanding the risks and they weren't just agreeing because they trusted the research team or even that they felt pressured.
Well, Wilson in 2005 also suggests safeguards to better protect the patients, like stricter stopping rules or shorter withdrawal periods, and the continuous monitoring. So that way, once symptoms worsened, intervention would have happened immediately.
That's important because it changes the focus back to participant safety. The study could still gather valuable data without placing participants at such a high risk.
I mean, overall, these changes highlight that ethical research isn't about eliminating all the risk. It's about minimizing the harm and prioritizing our patients' welfare. And that leads into the bigger ethical question whether knowledge gained from unethical research can ever outweigh the duty to treat our subjects ethically.
In the case of the UCLA schizophrenia study, even though it produced valuable information about relapse risk and the importance of maintenance of the antipsychotic therapy, most modern ethical analysis argue that scientific benefit does not outweigh the obligation to protect these participants from harm.
Exactly. And according to Wilson from 2005, he stresses that participants' welfare must always remain the top priority, especially when research involves vulnerable populations, such as individuals with severe mental illness.
And when we think about the HeLa cells example that we know in history, this shows that the knowledge from unethical studies can still inform medical advances, but that does not justify the original unethical violations that are happening.
Right. So continuing to use that knowledge doesn't mean the study was ethically acceptable. It actually reinforces why current research protections exist.
And Applebaum in 1996 argues that cases like this should serve as lessons, not precedents. They highlight the need for stronger oversight, better consent processes, and ethically sound study designs moving forward.
So even if the data is useful, it doesn't excuse the harm that's caused because the ethical standards exist to prevent repeating those same mistakes.
And as nurses, this really reinforces our role as advocates. So making sure research prioritizes patient safety, dignity, and autonomy above all else.
Overall, this study shows why ethical safeguards and nursing advocacy are critical in research involving vulnerable populations and why knowledge should never come at the expense of human rights.